it takes a while to have a proper diagnosis of chronic fatigue syndrome. So usually when we encounter a chronic fatigue patient, it's a long time from the inciting events, that whatever triggered it. And people will say, well, if it's the same basic triggers and the same underlying problems, why would, 6 months to a year away from the trigger be any difference than 5 or 6 years away from the trigger, or 10 or 20 years, which we see? The difference is that just like your body has this sort of preset, wiring to do a normal infection and have an up and a downswing, that's built into us genetically, thankfully. We also, when we have dysfunction, our body has built-in compensatory mechanisms that may not be the best health, but it tries to push us towards staying level. And in chronic fatigue, those compensatory mechanisms might have been there for years at this point. And, a lot of patients, it's, your body does everything it can to go back to normal. But when it can't go back to normal, then the next goal is, well, we can't just, fall apart and die and, it's something terrible. So your body tries to find a new normal, which doesn't feel good, but it's normal for you. So I'll tell patients what's happened is your body has decided, instead of being in fourth gear normally, it's just going to be in first gear because it can't handle anything other than that. So you're existing, but you're existing at 25% of, your normal place. And all those things we mentioned earlier, whether it's, your hormones or your immune system or the autoimmune side of the world, or toxic sensitivities or whatever, they get in the act there. And, they try and just adjust to make you exist, basically. So if you're long COVID a few months in, or a year in, or even 2 years in, the adjustments to abnormal static life are fresher and they're easier to sort of undo. If you have chronic fatigue and when you think about it, you've not felt well for 20 years, they're pretty far away. And your body now thinks this is totally normal.